The impact of institutional case volume on solid organ transplantation on patient outcomes and implications for healthcare policy in Korea. In solid organ transplantation, center volume is a strong predictor in both patient outcome and graft survival. Transplant centers in the U.S. are required by the government to meet a certain minimum annual case volume and acceptable patient outcomes such as mortality and graft survival. In Korea, unfortunately, such requirements currently do not exist. The waiting list for kidney transplantation is growing each year in Korea. There is a significantly higher risk of one-year graft failure in low-volume centers compared to high-volume centers. Also, there is significantly superior long-term graft survival in high-volume centers compared to low and medium-volume centers. In liver transplantation, the wait list is also growing, and there is a higher risk of in-hospital mortality in low-volume centers compared to high-volume centers. The long-term survival rate is also similar to the kidney transplantation, as higher long-term mortality in low-volume centers. The situation is similar in deceased donor liver transplantation. For heart transplantation, the center volume effect is most prominent compared to other solid organs. There is increased risk of in-hospital mortality in low-volume centers compared to high-volume centers, and there is a distinct discrepancy in long-term survival. The situation in lung transplantation somewhat differs from international reports, probably due to a small number of lung transplants performed in Korea. But there seems to be a tendency towards better long-term outcome in higher volume centers. Looking at the regulations regarding solid organ transplantation, there has been an accreditation process for transplant centers since 2007 in the US with qualitative and quantitative standards. Europe has transplant surgery training programs for transplant surgeons subject to a strict standardization to validate the ability to perform transplantation. The regulations in Korea are very minimal and basic, consisting of criteria regarding facilities and personnel. There is no oversight of transplantation centers, no minimal volume requirements, and no limitations in receiving insurance reimbursement claims. Our review suggests that there should be a minimum center volume requirement that should be implemented in policies regarding the accreditation of transplant centers and organ allocation.